celebrating Nelson Mandela's birthday and, of course, ahead of Mandela Day on the 18th of July, the Department of Health has committed itself to improving the lives of 250 patients at the Groote Schuur Hospital through its Mandela Day surgery project. Now, in this project, a number of people that are on the waiting list will be operated on by a group of specialized doctors from private and public hospitals. Now, Health Minister in the Western Cape, Dr. Bamba, joins us this morning to tell us more about this project alongside one of the beneficiaries, Robert Francis. Dr. Bamba, Robert, welcome to the show.
Good morning.
This is quite an incredible project. Now in its third year, it's grown to the point of being able to help 250 patients, which I think is incredible. But tell us about the free surgery project and why the health department has decided to do a project like this.
We are on our third year now. We started with 67 operations.
Wow.
And then the last year we were targeting 100 operations. We ended up with 195.
That's powerful.
So with the 25 years of democracy this year, we say we want to target 250. But we are around 400 now. But why is it important? It's about to bring dignity to the people. Because our theatre slate is quite long. There are people who wait long for knee surgeries. I think Mr. Francis is going to speak about his own experience. But with the staff where they put a lot of effort, extra time, because these are not conducted at the private. It's our staff who put a lot of effort realizing the Mandela celebrations. Of course, we have to do it through the resources, which is thank you to our donors who are there because we get privately funded.
Yeah. Let's talk about the types of surgeries that are provided and how are patients selected?
It's part of the list. So all the hospitals, they put all the lists together. There's a central list. Where now people, according to the severity of their conditions, and then they are selected from there. Nobody's jumping the queue. So if you were number 40 or number 400, you're still going to be, but instead of waiting for 4 or 5 years or 2 years, then you ended up being attended to. It's a various hospitals from the Red Cross. I think we had about 43, something like that, of the cases. It's the river, small hospitals like that with the cataracts for the eyes, knee replacement, hip replacement, joints replacements, and various ones, cataracts, the dental, and so forth. So there are many, there are quite a lot.
Talking about the many surgeries that are available, Robert, you were a beneficiary of this. Tell us more about the surgery that you had.
Okay, I had a hip operation. Arthritis in the hip. Ever since after the operation, I can run, I can play soccer again, I can play golf. I have no regret in doing that operation.
And how long were you waiting for an operation like this?
I've waited a year for it.
Wow. A year of not being mobile, of not being able to do the things that you love.
Yes. It changed my life dramatically. I can remember I loved to play soccer. In 2015 was my last game.
Wow.
Until I discovered I was diagnosed with arthritis in my hips. Couldn't do anything, I couldn't run. The movement was very, how can I say, you can't move. You feel like a person that is 82 and you're still 50.
Wow.
But after the operation, I must say I do thank you, the funders for this initiative they put into the community, and it helps a lot. There's a lot that's waiting. So keep on giving.
People who don't necessarily have the funds to do this themselves.
That's
Giving you your life back, your mobility back. You can play soccer again.
Yes, and golf.
And golf, that's wonderful. That is so wonderful. Dr. Bamba, I know that you are growing the scope this year to be able to assist children as well. Tell us more about that.
Yes, as I indicated earlier, that we have got about 43 children around that. Which is, it quite makes I mean, even for the parents themselves, it's not only about the dignity, it's also about restoring their life. It's unfair that for children now they ended up missing their childhood because of the illness that they have. So we've managed to extend more. Again, of course, we have to thank you, our sponsors. There are various ones, the Pick and Pay, the Mediclinic, and all those, even individuals who have managed to contribute. We want to do more, but because of the resources, but just to look in terms of how this can bring more change to the lives of the people when people contribute. Thank you for the Mandela Day.
Oh, thank you so much, Dr. Mbombo. And also thank you so much to the doctors who have bought into this vision as well, and who give of their time to assist and upgrade the lives of so many people who might not have had the funds to do it themselves. Dr. Noma French Mbombo, thank you so much for joining us, and thank you for always continue to pioneer these incredible projects within the health ministry. It's making such a huge difference in the lives of so many, like Robert as well. Thank you, Robert, for being here, and hopefully we'll see you at a golf day sometime soon. Wonderful stuff.